Please watch all the way to the end. Don't forget to like and subscribe. Please leave a question or comment at the end. We'd love to respond. Don't forget, please check out our website at www.mypfi.org. So prolapse is nothing more than a turning inside out of the vagina. In order to understand that better, let's learn about what a vagina is. It's a long tube. It's like a sock, and it's pulled up on the inside and held in place by ligaments. Similarly to back in the old days when they pulled a flag up the flagpole, you tie a rope around the flag, run it through a loop up high, bring the loop back, tie it to the flag, and when you pull on the other end of the rope, the flag goes up. Prolapse, the vagina is like a long tube pulled up on the inside, just like that. In addition to the pulling straight up part, it's also zippered to the inside of the pelvis, so it's tagged laterally or on the sides to hold it and flatten it out. So that vagina now is flat. It holds up the bladder, it keeps the rectum in place, and at the top, there's a uterus and there's small bowels that it's also being held up. Prolapse is nothing more than when with childbirth, the ligaments that hold things up stretch or break. When the zippering comes apart over a lifetime of running, jumping, lifting, swinging golf clubs, etc., that's when the vagina starts turning inside out on itself. The flag analogy, the flag falls down off the flagpole because somebody cut the rope. That's prolapse. Prolapse is when the innie of the vagina turns into an outie and you see a bulge, or you feel a bulge, or you feel pressure. So when we think about symptom-free normal, let's go back maybe 100 years, 150 years. There was a time when, as a woman aged, certain things happened to her body because back then they didn't know why, but we know now that hormones depleted and so forth. And women would have symptoms. Urinary leakage, for example, bulging, difficulty emptying their bowels, constipation, other symptoms like that they'd have. And because we didn't know what to do about it back then, we'd say it's what happens to older women, it's what happened to old ladies. For guys on the guy's side, as a guy got older, his prostate got enlarged, he ended up having to urinate 4, 5, 6, 10 times a night. He'd get up to urinate. That was considered normal back then because we didn't know what to do about it and we didn't understand it. As we came to understand more about prolapse and prostates, for example, we understand that large prostate in men is making this problem of urination at night happen. We also figured that there was a fix to it, and we had procedures developed to fix and reshrink the prostate and so forth. And what was considered normal many years ago is no longer normal. So for us, when we think about symptoms related to women getting older, pelvic floor symptoms, there's pelvic floor things like urinary incontinence, bulging, fecal or stool incontinence, constipation, and those kinds of things that we say to a woman, you're over a certain age, you're in that age group, you're leaking, it's normal, honey, just grin and bear it. Let's sell you some pads and some special panties and underwear and so forth and let you go off and live your life like that. That's normal. But in fact, it's not. Even though it's expected, you're not supposed to be going around the countryside leaking or having difficulty urinating. So there's ways now that we've developed over the years, and Pelvic Floor Institute specializes in fixing or repairing the pelvic floor dysfunction disorders that can cause these kinds of symptoms like urinary leakage, vaginal bulging, urinary and stool urgency, pain with intercourse, for example, that we can repair and bring you back to a kind of life that you had 20 years ago. We can make you 20 years younger, in effect, by symptoms. So even though you're this age, you can have this normal symptom set that you had when you were much younger. You're rejuvenated, you have a healthier life, and you can go out and continue to do the things that you've always wanted to do, that you were able to do at 40, even though you're 65. That's called a symptom-free normal. So it's not the normal in terms of what's expected. We've always done it this way. This is what your grandma went through, therefore you have to go through it. So even though it's expected and it's traditionally what we've seen, you don't have to live with it. We can get you back to a rejuvenated, symptom-free normal. That's what we're talking about. And at Pelvic Floor Institute, that's our goal. We say you get your life back. What we really are also saying, we can get you to symptom-free normal. And that's important to know. And that's special. It's a game changer. It's kind of like that ad for the motor car company back in the day. This is not your father's Oldsmobile. This is a different story right now. So look, if you're saying to yourself, hey, I got these symptoms and it's part of normal aging, but it's a cramping your style, if it's affecting your sex life, if it's affecting how often you got to stop when you make a long trip to urinate, if it's affecting the fact that when you go to the mall to shop, if that's what you like to do, you got to know where every bathroom is between every single store. If that's a problem, if your family members are starting to notice that grandma's always in the bathroom, why does she have to pee all the time? Why does she smell funny? Because she wears those really pads. She smells like pee all the time. If the symptom set is affecting you personally or the people around you, it's time to start thinking of, hey, what can I do about this? And when you start having that question for yourself, we at the Pelvic Floor Institute are here for the purpose of helping you answer those questions in a way that will pleasantly surprise you, because we can help you get your life back. It's also really important, in addition to thinking of the impact on yourself and people around you, what is it doing to your lifestyle? What's it doing to your job? Can you work that job that you like to work still because your symptoms are so terrible, right? Wouldn't it be great if you could have your symptoms back to normal so that you could go and continue to do the thing, the volunteering work or the job that you like? And it's going to be really important for you as you consider this is you may sit down and decide that I don't want to decide right now. Deciding to not decide is also a decision, and it's going to be really important for you to know that as well. So I think when you consider the set of symptoms that you have and you ask yourself, do I really want to live like this? If the answer is no, then Pelvic Floor Institute's for you. You need to be at the Pelvic Floor Institute talking to Dr. Hoyte or one of our practitioners and providers about what kind of things are possible for you to help you get back to that normal that you remember. Sometimes pelvic organ prolapse can be safely ignored. Usually it's best to be evaluated by a specialized pelvic floor care clinician to help determine if the pelvic organ prolapse can be safely ignored. Most prolapse can be safely ignored, but it requires intervention and evaluation by a specialist to help you determine that. Don't forget to like and subscribe. Please leave a comment or question. We'd love to respond. Don't forget, check out our website at www.mypfi.org. Thank you for listening.